Hi everyone, my name is Krista Tran. I'm a pathologist assistant, also known as a PA. My typical day consists of working in a hospital lab where I examine and dissect tissues that are removed from patients. These are patients that go into surgery to have a disease part of their body removed as part of their treatment. Um, I I examine all different types of body tissues, ranging from biopsies smaller than your finger to internal organs like your lungs or your thyroid, and even entire legs sometimes. Um, with these tissues, I describe physical features such as color, size, texture, weight, and I look for abnormal or diseased areas to write in a report. The pathologist uses this report um, and looks at the tissue under a microscope where they examine the cells and other microscopic features. I'm also trained to conduct exams on deceased patients to find the cause of death. Some of you may know this as an autopsy. So I go through a similar process of examining tissues from major organ systems. I send samples to the lab to be processed, and I help the pathologist write the final autopsy report. The educational background of a PA requires a bachelor's degree and a master's degree. So I went to a 4-year university where I majored in biology and took basic science classes such as chemistry, physics, microbiology, etc. After that 4-year college, I went into a master's program in pathology. And it was a 2-year program where I did more specific coursework in classes centered around cancer, genetic disorders, and forensics. I also got on the job training and worked alongside other lab personnel. Some skills that you need to succeed as a pathologist assistant is to have compassion for each patient. Even though I don't ever get to meet any of my patients, I still treat each piece of tissue as if it came from a living person. You also have to understand human anatomy and master lab practices such as using a microscope, handling sharp tools, and measuring things accurately, sometimes down to a millimeter. And then another important part of being a pathologist assistant is being able to handle really gross things such as blood, guts, and human waste. That's a normal part of my day-to-day job. The current salary range for a pathologist assistant starts at $80,000 per year when you graduate from PA school, and then it can increase to more than $100,000 a year when you have more experience or if you're promoted to leadership roles. The most rewarding part of being a pathologist assistant is that I'm providing care for patients in a way that's really unique. Often, I'm the only one who looks at the entire tissue specimen in detail. Surgeons generally remove the tissue without examining it, and pathologists will examine the cells under the microscope, but I'm the only one who actually gets to look at the tissue physically. So I think that's cool. My favorite part of being a pathologist assistant is when the pathologist and I will examine tissue and find a rare disease such as cancer or a genetic disorder in a patient, and that changes the way that they're treated, and it improves their quality of life because of that new diagnosis. If you're in high school, I suggest that you take all the science classes, including biology, physics, chemistry, even engineering, because sometimes you have to use mechanical equipment. If you're interested in math, I suggest you take as many math classes as you can, including algebra and geometry. And if your school offers it, try to take classes in human anatomy, human development, microbiology, and forensics. Some advice I have for people getting into this career would be that curiosity is a good thing. Don't be afraid to ask questions. Always look for details that others may have missed, because a pathologist assistant is a one person who will find, the smallest little thing that will change the way a patient is treated for their illness. Similarly, I found this career because I was curious about healthcare, but I wanted to look beyond nursing or practicing medicine as a doctor. You also have to be a lifelong learner as a pathologist assistant, because health and medicine is constantly changing, and you have to be able to adapt to the new things that come, especially with new research that comes out every single year. To find more information about being a pathologist assistant, I suggest that you shadow one, meaning that you can volunteer in a hospital lab or reach out to a pathologist assistant and follow them around the lab for a couple of days or a couple of weeks. There you can ask them questions about what they like, what they dislike, their lifestyle, and what it's like in general to work at a lab. So I appreciate your time, and I hope you consider a career as a pathologist assistant. Thank you.